Hi, this is the introduction video for Module 14. In Module 14, we'll be looking at mental health related issues for women, and we'll be thinking about diagnoses that exist, why they exist, how society has shaped the kinds of diagnoses, and also the rates in which they're diagnosed differently in men and in women. And also we'll be thinking about different approaches to treatment, which will bleed into Module 15 as well. This will give us a little bit of an introduction. In the textbook, we'll be reading about PMS as a culture-bound syndrome, which kind of hopefully will open up our minds thinking about how some of the diagnoses that are in the DSM aren't necessarily in there for a good reason, and don't add a whole lot into understanding women and women's mental health related issues, and how having a diagnosis like for PMS changes the way women think about their own experiences, and how women label their own experiences, and how it can impact how you kind of go forward into the world. And especially when we're thinking about recommendations for treating PMS, such as stay at home if you're experiencing PMS, and what does that do? Keeping women out of the workplace, perhaps. And so one of the major things that I want to be thinking, as I'll be thinking about as we're reading the readings for this module, is this idea that the problem, mental health related issues, the problem doesn't always lie within the individual. And this is for men and for women, but of course we're focusing on women in this class. But so sometimes the problem does not lie within the individual, sometimes the problem lies within society. And so we can think about that as causes of mental health related issues, but we also need to think about that when we're thinking about treatments. So if we're saying that, something like eating disorders, which we already read a little bit about, is at least in part caused by things and messages from society and from media and marketing, from our peers, then we ought to be thinking about treatments that address those more systemic level issues instead of just trying to fix the individual, because it's almost like the symptoms that show up at the individual level are just a symptom of these things that are happening at a more systemic level. So if you're interested in psychology, you're becoming a psychologist or work in the mental health field, it's important for all of us to be considering what messages we send to our patients when we only acknowledge problems at the individual level. And that can be an invalidating experience whenever a lot of people, whether some people are aware of it and some people aren't, that there are things happening at these more systemic levels that can definitely impact what our clients are walking in the door with. And I think the final message from the book, the chapter 15 from Half the Human Experience, is an important one, that as psychologists, you need to be thinking about yourself as a social and cultural being who we all have our own biases that we bring into a therapy room, and those influence the kind of therapy that we do. So we need to check in and be aware of our own biases. We need to acknowledge the fact that different cultures, people from different cultures and people from different walks of life will benefit from different kinds of therapy. And we also need to then become aware and educate ourselves on what these different forms of therapy might look like, so that we are able to best address our clients' needs. So I hope that this kind of like introduction to women and women's mental health needs is helpful for you. And enjoy.